We're live, and whoever tunes in, tunes in. Okay, so I just started by I asked you who had. I'm sorry if that gives you pressure too. It's just on me. It's not on you guys. So I just have to learn how this technology works. So and I'm just gonna let it. If anyone's watching, they'll go on sooner or later. You said you had it before. You said right? The CPR training. Yeah, everyone. All right, good. And it said it stands for cardio pulmonary resuscitation. You're not supposed to walk on somebody when you're on the ground. All right. So the cardiopulmonary resuscitation is a process of bringing somebody back who is non-responsive. So you wouldn't use it on somebody who was, if you could talk to them because they're breathing already, you know what I mean? So you hear stories about that. Somebody's laying down and somebody comes over and says, "Oh, they're on the ground," and starts pounding on them. And they're like, "Get the hell off me." So that just, it's you got to make sure the person is not responsive. It's in the instance that they cannot respond, so they're not, and there's a system that we're going to go through that tells you how do you find out if someone is not responsive. All right. So okay? Yeah. So you know what that was, cardiopulmonary resuscitation. I don't have to spell that out. But so there's a are you okay type protocol. Are you okay? Are you okay? Yeah. So we call it it's the 3 C's. Let's see if I can remember all this early. 3 C's. Call the first thing you do, and then you're gonna check. What's the last thing you do? We call, checking is making sure, whatever, and then we're going to try to give some type of care. 3 C's. Care is the third one. Call. So if I ran up on the scene and there's more than one person, if I could start doing what I need to do, attend to this person, the other person should call. If you're by yourself, mind the shot, yeah. If you're by yourself, then you call first, yeah, and then we go. Some people just rush over and it's like, you should have made that call. You'd have had help coming, Because once you start, you can't stop. Don't stop. It'll be an hour later, keep going. Yeah, The stories where somebody would come back, like it would just be somebody they've been working on for over an hour. I have a friend who's a nurse, and she works in a thoracic unit at Brigham and Women's. She said one time they did an hour and a half CPR, and the person came back, and I was like, oh, that's so beautiful. Like, you know what I mean? Like, yeah, there's other stories where they don't, but never give up. So call first, check, and then you're gonna administer care. Now, the only thing about this system is prioritizing like what you do first in scenarios. So say I was coming into a scene with someone on the ground. I don't know if they're unresponsive. What do you think the first thing I could do to check to see if they're unresponsive?
Before you check?
I mean, from a distance. So, I'm coming into a scene. Yeah.
Well, before you go to the person, you need to say.
From a distance, you could just look at the person's chest. If it is breathing. Is it? Yes, from a distance.
So I'll even back up. Is it too hot in here? Is it me? Is it getting hot? It's hot. All right. It's the heat's booming or whatever. I'm gonna check it in a second. So yeah, the first thing you come into a scene. Survey the scene. Exactly. Yeah. So I said check on them first. But the first thing you got to make sure is you're safe, right? Like yeah. Because I mean, there's scenarios where you go to give somebody help and they might have been the victim of an assault and the people think you're with them and then they come back and get you. Or what if there was electrocution? Yeah, you don't see someone who's electrocuted and you walk into it and you're like, so you got 2 people laid out. It could be a gas that you don't smell. You had it. How long ago did you have yours? You had yours recent, right? 2 years ago. 2 years. Yeah, you remember everything. So it could be a gas. It could be anything. Excuse me. A fire that's just about, you don't see it and you go and it's like, so the first thing you do, you have to check. If I came in, first thing I'm going to do is, it's like it's a slow safety check. You don't want to just run up on somebody, so you'll check and you'll see, you look around your surroundings. If everything's all right, what's the other thing I could do now? I'm in proximity if someone's on the ground. What could I do to just alert or wake them or
check if the person is responsive.
Right. So what do you use?
The code.
I use my voice, right? I don't have to touch them yet. I'm gonna yell a little bit.
Are you okay?
Yeah. Hey. You know, I wouldn't do it soft. Hey,
It's
you
not-
okay?
no.
Yeah.
Hey, you okay?
And there's another reason also. Say that person's been drinking or they're under the influence of something. So you just go running up on them, and next thing you know, you guys are in a tussle on the ground. It's like, yeah. So they all. When I took my training, they taught me when you approach somebody, if they're unresponsive, first you do it from a distance. So we'll if I was, this is a good safe distance from someone, I'd say, hey. If there was no if there was no answer, I get a little bit closer. I come down here. I'd approach from the head part because they said if you approach from this side, yeah, and you startle them, you got problems again, you know, and that happens a lot of times. So you'd approach from the head side. You did your call from a distance. This is your second call. You're gonna get closer and you can say, hey. And you don't have to yell this close. You say, yeah. And then if that doesn't work, just 2 solid taps here. Hey! If they don't move after that, you know that something's definitely wrong. Yeah. All right. So we're still in safe position, and then we're gonna go down for 10 seconds and just listen. And you don't have to count out loud. You can just do it in your head, but you're gonna make sure. While I'm looking this way, I could actually see their chest is moving too. So I'm listening. I'm feeling for anything. Nothing's happening. Now, being that you guys are certified caretakers, usually you have a personal protection equipment.
Yes.
Yeah. So this is the point where if you have your gloves, put on your gloves, and they have a mask that you'd have also. All right. And the computer is not going to fall off because I caught that, man. And this is going live. Yeah, it's good. One person's watching. All right. So you get a mask. It looks like this right here. It has a picture of a face on it. See that? It has 2 fingers like that. Where you pinch your nose. I dyed my hair and I got black fingers. That's not dirt. I was showing them that I got dirt on my hand. That's not dirt. That's dye. I'm old. You see that? All right. So, but this is what you get. Your personal equipment should have one of these in it and a pair of gloves. And you put your gloves on. Gloves might make my hands sweat, so I'm not going to put the gloves on. But once you see that this person is not responsive, we check for 10 seconds. We call from a distance. We make sure we were safe first. We call from a distance with our voice. Third attempt was to tap the person. Then we sit there and we acknowledge that they are not breathing. We don't see their chest moving. Safety equipment. Because what if they have blood or something like that? And we'll get into that scene first. But so there's no blood in this one. So say they're not responding. So everyone good? Any questions? You good? You taking notes? All right. Tell me if I'm going too fast. All righty. So this has a diagram. So we're looking at this diagram right now. Person's unresponsive. We're going to put this over their face, just how it is. This part is a breathable part. Put that right there. Yeah. We're going to pinch their nose. Close. Why do you think we pinch the nose?
So the air doesn't go back when you
Right. If you blew into someone's mouth and their nose is open, it'll just, yeah. Especially if there was something in their throat. So speaking of the throat, we're gonna pinch their nose. We're gonna take our 2 fingers here, lift their head back. Yeah. Lift their head back. I always skip something. Let's go back. You can make mistakes. Everyone makes mistakes. Hey, put this here. They can show it like that. Sorry. So I make mistakes. Can you see this? So you let's take this off. I put on my mask, my hand gloves. Before I do put this on, I'm gonna tilt it back, pinch a little bit, but I'm gonna look in there and make sure there's no food. Yeah. Because if there was food in there or something like that, I mean, it's just not gonna work. So I take my big finger, I take my finger like this, and I sweep out. Do a sweep, look in. You know, this is going at a fast pace. I'm doing it slow, but but you don't panic. You know what I should have told you the first thing you do? Take a deep breath. Because some people are running, and it's like, yeah,
that's true.
And you get nothing done. Michael Jackson, his doctor was a professional doctor. Michael Jackson's doctor was a professional doctor, and he did CPR on a bed. Meaning, the body has nothing to go resist against it. So they're there for half an hour and it's getting nothing. You know, the point is, I didn't make the point too, is to keep oxygen to the brain, no matter what. Remember we said we don't stop?
Yeah.
Am I going too fast? It's all right.
No, you're good.
I'm good? All right. Sometimes I talk too much. Let me take some water. Yeah, that's so crazy. The number one musician in the world died because, I don't know if he would have lived, but I think he would have lived if he would have got good CPR, right? Yeah. That's crazy. That shows you that, you know. So it's very important you pay attention. On the bed, how you know? You see how a bed is. It's just you get nothing out of it. So yeah, Michael Jackson. I mean, so you want to make sure the person's on a flat surface. And the key is to always, we're trying to keep oxygen to the brain. The brain will live as long as there's oxygen. Even in the event that the air pathway is blocked, you will still, as long as you're keeping that constant, 30 compressions. Yeah. You start out with 2 breaths. So where did I leave off? You guys want to recap, or did I go too much?
Yes, do your recap.
A real quick recap.
Yeah.
Want me to act it through?
Sure.
All right, good. I hope I don't forget anything.
Say it then.
Because remember, I forgot to clear that. We are, the point right now is we're going to be putting this on, but I'm going to go up to that. All right. So I come into somewhere. Action. Not action, but it's like a movie. The movie is rolling. Can they see me in there still? All right. So you're going to walk in. I'm going to check and make sure, okay, no one's hiding. No one's up in the corner trying to rob me. No fire. No gas. All right, there's nothing next to him. There's not a bomb. There's nothing. Okay, there's no cord. There's no electricity. Take a deep breath. All right, what am I getting into? All right, somebody's on the ground. Let's go. All right. So I come over here. Oh, sorry.
And you go.
No, I made a mistake. I checked.
Yes.
Hey.
Uh-huh.
Because I was thinking, it's just so scary. I just imagine if that was really somebody on the ground. You're like, all right. I'm crazy like that. So it's like, hey. Come a little closer. This is the bad side, right? So I'm coming over this side, getting still over it. Hey! Still nothing happened.
Yes.
Tap, tap, tap. All right, man. I'm gonna go down here. I'm listening right now. Yeah, he didn't jump, so it's good. I'm still, you always gotta be alert too.
Yes.
So I'm looking, any movement, anything, like, you can bite your ear off, something.
Yes.
All right. Hey, listen, nothing. Chest is not moving. Okay, cool. I'm all right. So I put on my equipment. Let me get my gloves on. Gloves on. Get this out. All right, let's go. Wonderful. But I say, wait, before I do that, I'm going to still pinch back, but I'm not pinching all the way. Check in there. Anything in there? No? Nothing in there? Just let me check.
At that time, you have your gloves on, though.
I have gloves on.
Yes.
I just didn't because...
Yeah.
All righty. So good. I see this. This lines up like this. Just pinch it. So I'm not going to rush them so I can explain it now. But you saw everything that I did. So now I'm gonna pinch and lift back with my hand like this. We know that the airways clear to the eye. If I went 2 breaths, that's the first one. Another one. 2 breaths. The head's lean back and the airways clear. If that chest is not going up, that means something might be in there. Hey, you know what? I'm looking. Nothing happened. All right. I'm gonna take my palm, like using the force like that. I'm gonna put my arm straight like that. Take my other hand. I'm gonna lock my fingers like that. Take that like that. Lean my shoulders right over. I don't want to be like this because if you're going like this, you can't get any power. All right? You use your body like this. 1, 2, 3, 4. Now it has to be at 100 beats a minute. The way I remember that is they have a "Staying Alive" song by the Bee Gees. So I already started out too slow. You have to you can't go too fast, but you have to remember that 100 beats a minute. So it's, 1, 2, 3, 4. I have to count. So 10, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Anything happen? No. All right. Tilt back. 1 breath. Tilt back. 2 breaths. The chest was going up, or if it wasn't going up, still not, go back right to the center. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right, check again. Nothing happening. One breath. Nose pinch, lean back. That was 2 breaths. Was that 2, right? you can lose count, you know what I mean? So, all right. What did I didn't do that I said I was going to do? Did I call? I didn't call.
Oh, yes.
I didn't call. That's what I forgot because I panicked. I saw bodies on the ground. So it's the first thing you do. First thing you got to do is use your phone and call. That's the first thing you got to do. Yeah, first thing, because it's just smart. It's like that's your connection to the professionals. We got to do this until the pros. We're pros, but I mean, till the EMTs come with the big equipment.
So you call before you survey your scene.
I mean, so even let's be realistic. So we're walking up, and I think if you saw somebody on the ground, at first, if I have a phone in my pocket, I'm gonna be like, oh wow, 911 immediately. Yeah. So yeah, call, check here, call, check, and then we start doing our professional stuff. So you think you guys are ready?
Yes.
You think they're ready? All right.
All right. So let's just go back to that.
Go ahead.
What is this called?
This is
I know it's your PPE. Whatever.
Personal protection equipment.
Yes.
It's called a face protector.
All right.
Yeah, I don't know, a face protector. Yeah. So you might not have this. So I mean,
I know.
But it depends. And I'm gonna give you scenarios now. Sometimes when people on the ground, they're gonna have vomit on them.
Yes, so you need that.
Urine. I don't know what they can have on it. They can have wounds. They can have blood. So it depends on
situation.
Yeah, situation.
But the thing is, if I comes in and I see somebody with blood or vomit on them, I'm not gonna try to put mine over it.
It depends who it is. What if it was your child?
Yes, that's my.
You can have anything. I don't care what's on. Yeah, you know what I'm saying? Or even anybody's baby. For me, it's like it's a baby. I don't care who. Yeah, I'm just gonna take care of the baby, even though it might be a deadly disease. What if it was Ebola? You got to think about stuff like that. They'll say, "Oh, there's an outbreak. Someone went into cardiac arrest," and they say, "But they have hepatitis." So you wish you had one of these, and in that case, you do. I mean, you make this call. Your life. It's like I wouldn't do it. I wouldn't do it.
Yeah, you can still call. They will come and
take
care of you, not you.
Yeah.
You call.
There's other times you don't know what a person has though. What if they were drowning and you're just moving? You're like, we want to save this life. So it depends on, I love my life, but at the same time, I mean, it depends on the situation.
Depends on the situation.
Yeah. But most times though, if you're in a professional setting at the hospital, they'll have one of these. And you forget it.
Yeah,
and if they're in a hospital and people are sick, you say, yeah, I'm sorry if I talk really fast. But so yeah, this is called just a face shield. That's all. Any other questions? Y'all ready to do some work? I don't have now. I can turn this off now too. You don't have to do it on camera. There's pressure with the camera. I'm just doing this to see if it works.
So it's
100 beats per minute. That's so. You see how I started off too slow? 30, I was like 1, 2. But it's the song like the disco song. 2, 4. Even maybe calypso. I don't. Feeling hot, feeling hot, It's like one of those, it's just always on the beat. Yeah, at 100. I think a lot of music is at 100 beats a minute. So it's but you got it, because if it's too slow, it's not gonna do it. So you're ready to get down? Mm-hmm. Try it. You don't have to. I mean, just here's another important thing I didn't say. I'm not covering everything. So on an adult, you want to make sure that your compressions, when you interlock your hands like this, you're keeping your arms straight. You're right between the 2 nipples. I didn't say that either. I took it for granted because you took it before, but you got to go right between the nipples. Here's a problem with today's society, right? You might have somebody whose nipples might be down here somewhere. That don't make no sense, right? But they're because you might have a 500-pound person. Yeah, so you can't find the middle of the chest. It's just real. It's like you'll be like, oh man, there's just a massive body here. But you have to look at their head. You see belly, and you're like, all right, their heart must be somewhere around there somewhere. And it's for them, it's really important that you use the point I was going to make. You go down at least 2 inches or more on a double. So if I was going too shallow like this, I'm not doing anything. So you got to make sure that chest is going down. Yeah, on an adult. Now here's the opposite side. If the person's a small little body, 12-year-old or less, and they look fragile, you want to go 1.5 inches or less. Because you could break. So there's stories where they did more damage than good. You end up smashing somebody's rib cage. So especially when we do that, I'll show you how to do an infant. But you got to make sure. That's the one thing you got to make sure is like if it's an adult, 2 inches or more. If it's an infant, 12 years old, not 12, I'd say about till 8 years old. Yeah, and their body's small, you want to go 1.5 inches or less on it. And I'll show you on that. Let's see. Any questions? I don't think I forgot anything. Usually I remember everything. I try to keep notes, but sometimes I have some notes here. All right. Yeah, I have notes. So, but I don't think I need them. All right, so here's another situation. Is that good, or you want to try it, or you try afterwards? Let me run through it, and you'll try it afterwards, so I can do this video. So, say we were on, but it's relative. So we'll just go into the AED, and then we'll do the infant after that. You need a break or anything like that?
No.
You sure? It's hot in here?
We are old.
Why am I over here sweating? No, I'm sweating beats.
You can take a break.
I'm gonna take a real quick break. Plus, I have to check and see if somebody showed up. Be right back.
Yes.
All right. I'll take a quick break. I'll be right back.
Yes.
I'm not tired. I just have to make sure everything's cool. Play some music. I'll be right back.
Unless they move back like I alcohol, yes.
I don't want AIDS. I don't want this. I don't want that. A call.
Just call. See someone on this street, go up to them.
I did this like about 6.5 years. I didn't have to use it. I don't even know where the card is.
Nobody showed up.
Somebody else?
No, it's just us. So this is good. All right. So when I leave off at the AED, I won't use it. The Beatles, though. I like the Beatles. I play guitar. And I'm trying to play the Beatles songs. These Beatles songs are really sweet. You know the Beatles, like yesterday, all my troubles. When we're doing other things, I'm play that. So I was at the AED. So this is called an AED. What do you think that stands for? First word is automated. Automated. I always got it wrong. I was like automated electric, automated whatever. It's called an automated external defibrillator. I can't forget that because external. It's outside your body. Yeah. A pacemaker's inside. This is outside. Where do we find these? Anytime you go into a hospital, you might see one of these on a wall. And if you or maybe even now, nursing homes, they have them. Or sometimes you go inside of supermarkets, the Walgreens, they'll have one somewhere in the store because elderly people go there, or maybe someone who's ill. So this is called automated. What?
Defibrillator.
What's the middle word? I already forgot. External. Always remember it's external. It goes on the outside of your body. So you'd open up one of these, and I'm just gonna look and see what's in there. That's So this is the instance. Somebody's on the ground, and then you say, "Wait a minute." You look and see one of these. So now here's a new step. Call is always first. Call somebody, but now you're like, wait. Yeah. Now you're like, I got this thing here. So what is this? This I don't know. So hopefully if there's two people, maybe somebody could be checking on the breath, or and the other person could be opening this up. I'm opening this up. I'm gonna open it up immediately, and I see something electric. What do you think I should do first? I'm gonna put it down. All right. So if the scenario is now same thing, unresponsive. We checked, no breathing. Say we're here by ourselves. We look up. We made a call. We had a cell phone, and then we look up and see this. All right. I would say the next thing, grab one of these because it would just if you're comfortable, I'm gonna show you right now, so you're gonna be comfortable using it. And I just open it up. When I open it up, there's a little thing inside of it, and it's an electronic device. It looks electronic. It has a green button. I say, you know what? The first thing I'm gonna do, make sure it works, because you could be like, oh, there's stuff in here. Let's play. Okay. You're trying to rush. You're panicking like I was panicking. And you start looking at this stuff, and it's like, first thing you gotta make sure there's a battery in this thing. Is there a battery in it? Uh-oh. Is there a battery in it?
Oh, yes.
All right. So I just hit that button.
Apply pads to patient's bare chest.
What?
Plug in pad
All right, hold on.
connector next to
I'm gonna turn it off for a
flashing
second. So that was the first thing I was doing, just to make sure the battery was in it. Battery's working. All right. So then it's gonna give me the instruction. Yes. But you just heard in that first instruction, it said to the patient's bare chest. So this thing, you can't, no clothes. So the instance is there's clothes on this person right now. Yeah, I just have my shirt. That's bad. I ain't putting my shirt on. I don't want to be late like that. Right? I'm like, nah, man. All right. But anyway, you rip the person's, whatever you got to do, cut, whatever, get it up somehow. They're also, so this is an electronic device. I'm gonna give a precursor as well. What if the person this is electronic? What we know about electricity is, what if the person's wet?
Okay.
Yeah. Or if they're sweating a lot of times when somebody has a heart attack, they drench with sweat and then drop. So, and we have an electronic device here. So the first thing, because that's not going to tell you they says bare chest, but it's like you have to make sure the person is dry. It could be sweat, it could be blood, it could be vomit, but it's going to be, whatever it is wet, it's going to be conductive. And you want the shock to go through the body. So if you put 2 pads on the outside of a wet body, it's just going to arc to the other pad. They get nothing out of it. The body won't even, it's supposed to jump. So you got to make sure it's dry. You don't got a towel, anything. Use their socks. Pull their socks off. Anything they got. Pull, their hat, whatever it is. Make sure this area where these 2 pads are going to dry. So let's go back to the scenario now. This box is on the wall. We're going to back it up a little bit. This box is sitting on the wall. So we're going to walk in. Somebody's on the ground. 911, somebody's on the ground. We do our check. Hey, get up, whatever. We're going to grab this bad boy. Hey, get up, whatever. You okay? No, check them. And we say, all right, we got this. So I open this up. I'm like, I can start doing this, but you got to make sure the batteries are in there. Some people have been there 10 years. It's like, that thing don't work. All right. So I'm going to hit that. And I take everything out the bag. I'm going to hit it again. Hitting this thing right here.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
There's a little picture on the pad. You see a little picture on the pad? Yeah. So you're going to take and pull this stuff off right here.
Apply pads.
Plug this out. I'm trying to, I'm supposed to have these on. Rip them off. Put one there, it looks like in the picture. Put one here. Plug it in. It's not moving until I plug this in anyway. I got to plug it in.
Apply pads. Analyzing heart
So these supposed to
rhythm.
be stuck on there right now. This is doing the work for you.
Do not touch the patient.
Do not touch the patient. Those are stuck on there. I get back. It's electric. I make sure it's dry.
Shock advised.
Shock advised. If anyone's around like that.
Charging. Stay clear of patient. Deliver shock now.
Now I press this
orange
button.
Now. Shock delivered.
Boom! Body jump.
Begin CPR.
Don't take anything off. That's the beat we're going to. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Oh shit. All right. You keep going. It's supposed to. We do 30 and 2 reps, but we're supposed to listen to this because it's giving a shot. Sorry. There you go. You keep this going. See how you can get but you just keep, this thing tells you what to do. And I'm not going to go for an hour doing this thing, but it tells you what to do. You know what I mean? Yeah. I shouldn't have stopped. But luckily, and then it's supposed to go into another shock until, I don't think this one does it. When I was in training, they have a device usually tells you to go back. The new ones tell you, okay, but they tell you everything to do. So you just got to listen. What is it?
So, excuse me. So there is a special spot on the body where you put these 2.
Look at this picture right here.
Yeah,
Look at the picture.
I understand.
It's not really special. Everyone's heart is a little bit off to the left.
To the left.
Yeah. So look where this one goes. Down on the side, the lower left side. Yeah. And then the upper right side, right there.
Oh.
And you want it to go, that's where the inside the body is just going to go right through the heart. So, any questions on that?
But is there a lot of hair on the chest?
If they had a lot of hair, yeah, this has to reach skin. So they said it. If you that's right. There's cases where they carry a razor. They're so smart. But thank you. Some cases that they carry a razor when you got them big bear, dudes, and you gotta just do a quick.
Some people have head on their chest.
Yeah. That's what she was saying. It's like hair on their head on some dudes. So yeah, it's crazy. So this tells you everything to do. I'm trying to think of something that would puzzle you up. I'll show you how to use it on the infant. It's the same thing. I can even show you really fast. Well, let's go on to infant CPR. All right, which is the worst CPR. I mean, I don't like the infant CPR. You know what I'm saying? You don't want to ever have to do that. Oh my God. Anyway, it happens though. I'll tell you a story. I'll tell you a bad story, but it's a real story.
One question.
Go ahead.
Do we have to start CPR before, if we have the defibrillator, which one we put first? We can start CPR before we use that.
I think I know this goes on first because this is going to give a shock that we can't give. Pumping is one thing. We're keeping the blood going. But this bad boy could actually, like a car, it makes it come back. Yeah, so if the AED is there, use the AED, If you don't know how to use it, you might be better. Yeah. But make sure it works. It has 2 pads in there. It tells you everything to do. And we don't take that off. Like, we don't, okay, the EMTs take that off, leave that on there, and just let them do their thing. We don't ever take anything off. Once we apply, that as a first responder, when you apply something, you're not taking it back off. You let the professional teams come in and do their job.
As soon as they come, they take over.
Yeah, they take over. That's why that call is so important. It's like, man, if you don't call, you're gonna be there, and then you're like, oh, now I have to call, but I'm doing compressions, and you lost time. It's like that call is so important. Call. The easiest thing you could do is call. So
or even if you are going to start, you could ask somebody to call.
Yes.
But if there's 2 people.
Yeah.
But a lot of times you might be by yourself or whatever. So
By yourself, call first.
So any questions? No?
Yes.
We're gonna get out of here fast. Good. No, you guys know it because I know you're asking me questions that I should be saying, and it's like, good. Tell me what I'm forgetting. All right. So this is a scenario where it's an adult, and now I'm gonna go into the infant, which is not pretty
So
cool.
can we just know that you go through this?
We're gonna practice.
I know.
Go ahead.
Instead
tell me.
of going to the kid first again, so we just get this one in the brain,
Go ahead.
and then we go on to the kid.
Okay. It's the same. No, the kid is really easy. It's the same thing. That's why. And then we're not going to do the kid. I'm just going to show while it's going, and then we'll. All right. So this is a beautiful little baby, and it was like I don't know what happened. It says
Again.
I don't know. Oh, it's a girl. It's a girl. Pink.
It's both.
This girl, little baby doll mannequin. God forbid, it's just a baby doll. But okay. So here's a scenario. Usually, when you come across someone with an infant, there's usually a caretaker, parent, etc. And when you approach somebody, excuse me, a little water. When you approach somebody with a baby, if you try to just run up on somebody, they could be panicking like, "Oh my God, my baby!" But if you just run up on them and try to take their baby out their hand, you could, it's like it's a mother's instinct. She's panicking, but then she doesn't realize. I'll tell a story. I was down in Florida one time. A lady passed out with her family. And I didn't know CPR, but I was like, "Oh, let me help." One of the dudes was like, "Yes," and I was like, if any other situation, I would have confronted him. I was like, "Oh, I'm all right. Let him, it's his mother." But it was like you gotta say, and I didn't even know how to help. I just felt bad that the lady was laying on the ground, but I didn't know how to help. So anyway, you gotta get consent from somebody visually, otherwise it'll be a worse situation. So you say, "Hey, you're certified." Say, "I'm certified in CPR. Can I help?" Yes. As soon as they say yes and make that eye contact, you say, you take their baby, find a flat surface if the baby's not responsive. And it's different from adults because it's a small body. So instead of, a baby, the name might not do anything, but their feet, you slap their feet. Usually there's a kick response, but you'll see something, and then you'll at least see some movement in the body, anything. It would and if you still don't see, God forbid, if you still don't see anything, you're going to look in a baby's mouth. A lot of babies die from choking. So it's like, I have a story I'll tell after this. So the baby's mouth is small. I check, the baby's not breathing. Okay, the baby's chest is not moving. I'm moving fast. Take my pinky, look in there. If there's nothing in there, swab it out. I mean, if there's something in there, swab it out with your pinky because your smaller finger. The baby's face is so small that when we use this, now I'm going to put on our equipment because you always protect yourself in any instance. If you have it, use it. If you don't, it's up to you if you want to still proceed. On children, I think we just proceed. So you'll tilt back the head of the baby. You're going to just use your hand and tilt it back this time. And because the face is so small, you can cover both with just your mouth one time to breathe, to do the breaths. So we're checking right now. No breath. We're going to do 2 breaths. We clear the mouth. We put this on if we have it. And so we're just going to go through. That's 1. 2. You do them hard, but not as hard as an adult because you don't want to, the little body, you don't want to, and everything. You could blow the eardrums out if you did too hard. So if we're moving fast again, still no response, we're going to take 2 fingers, whatever 2 fingers that work. My fingers are kind of jacked. That is not dirt. That is dye. My 2 fingers are too long to go this way. See how like one's too long, but my 2 center ones are weird that they're kind of. So I'm going to use these 2 fingers. I look for the nipples. I'm going to go a little bit below it because it's a little bit different. And then we're going to go right in between there and do the compressions again. 1.5 inches down or less. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Nothing happening. Tilt back. 2 breaths again. Nothing happening. 1, 2, 3, 4, 5, 6. We keep doing that over and over until EMS comes, and just it works. It works. Keep the blood going to the brain. No matter what. Until for you keep and for everybody. You just for babies especially, of course.
30 also.
30, yeah. It's the difference is we don't go down more than 2 inches because they're small little body. And the difference is instead of tapping up here, they're not very responsive there, but the feet kick. Remember, babies always you just do the feet. So they might be bigger, 2 years old or something like that. That's when it changes. You'll know when you can pinch or not pinch, but usually a baby's face is so small that you don't have to pinch it up. You cover everything one time. All right, this baby's good. We were just playing, baby. So I went into that because that's all for CPR, and then we're gonna do some testing on the adult model, and we're gonna do some testing on the baby too. Any questions about CPR? About the AED? I probably missed something. I'll come back to it. It's early. Well, it's not early anymore, but I probably missed something. All right. If not, we're gonna move on to first aid scenarios. CPR, first aid, and what else? Yeah, first aid scenarios. And I'm gonna check that heat and see what's going on with it because it's a little bit hot. Hold on 1 second. Let me make sure. Is it hot in here or is it just me? Maybe me. I have tea here and I won't drink the tea because I'm like, it's hot. Because I move so fast and I talk so fast.
Yes.
All right. I'm going to write on the board, which I don't like. In school, I didn't like that. I like when everybody faces in a circle like a tribe instead of, you know what I mean? It's like, instead of someone just talking to you, I don't know. The new schools, everyone is facing each other. I think the progressive one. But there's got to be a change. Where'd you guys take the CNA stuff from? Where'd you get certified for your CNAs or nurses?
I'm CNA.
You're a CNA? What are you? You're a nurse? You're a nurse too? CNA. And when did you get certified here?
No, from the Red Cross.
Red Cross. Okay.
Yeah.
Long time ago?
Yes.
All right. I'm gonna walk on this. I was just wondering. We have all the courses here. I'm like, anything you need. Yeah, it's the best. It's the cheapest and it's the best. So we're going into first aid right now. So say we were going into a scenario now. Now the scenario is people. Do you want to test on mannequins now or afterwards? We'll test on afterwards. We'll just keep it flowing. We come into a scenario and these people are talking. You know what I mean? So there's an acronym that you use, and it's called SAMPLE. S-A. I don't know why. It's right there. I'm like, what the hell is it so hot, man? The thing's blowing on my head. I'm crazy. It's blowing right on me. So sample is when you walk up on somebody and they are responsive and you're trying to diagnose the situation to the level of care that they need. So the first thing you're looking at is you want to know the signs and symptoms. Let's write signs first. Signs and symptoms. I'm going to put tape over this thing because I'll die. Another time. Well, symptoms. All right. So that means, this is what I can see from a distance. If I walked up and I saw somebody and blood leaking out of them, I know that there was some type of assault or an accident where they were shot or something, or they got beat up. But I know I can see that from a distance, blood. But then also you have to, if they were still conscious, I have to ask them, well, I have to see. This is what I'm seeing, signs and symptoms. So if I see the signs and symptoms and I can get a response from them, I'll ask them, do they have any allergies? Or if it wasn't blood, if there was still something's wrong with them and I can't tell, I'll say, okay, do they have any allergies? Signs and symptoms also if I saw sweat, if they were shaking, if they looked blue, if partial paralysis or something, but they're alert. If they talk, but they just can't, we don't know what's wrong with them yet. So if I couldn't get it from the signs and symptoms, the visual cues, I'll ask somebody, do you have any allergies? Because usually that's one of those things where it would affect you. It comes upon you and you can't tell. Kids will eat some peanut butter and they have a nut allergy, and next thing you know, their whole throat swole up. They can't talk. And it's like you have to ask them. So if you have any allergies, if they don't have any allergies, then you say, do you have, what's your medication? Medication. Something you put in your body that, I think that's one of the biggest things that ERs get right now is adverse reaction to medication. It's always something you took that just didn't go down right. Too much insulin, too little insulin, or diabetic, or anything. You take too much of that heart medication, it throws you off, throws your water off. Yeah. So medications. You say, are you on any medications? You could be anything. It could be things looking at the ground. It could be psychoactive medication that someone's on. So anything could affect you, and it's affecting the way they're acting, and they need help because they're incapacitated. So if it's not medication, the next thing you ask is pertinent medical information. That's anything. Oh, I had surgery last week. Oh, and now I have pain in my side. Oh, I don't know. Medical information. I had a rotator cuff surgery, and I don't know. It could be anything. It's like. So you ask them, why are you in pain? Why are you clutching your arm? Or why are you bleeding? You think your stitch is ripped? Or you took too much blood thinner and it could be anything. So pertinent. And while we're doing this is information we're taking for that call. Like we're still going to call. We're just trying to give we don't have any information. So I would still, if I saw somebody who was shaking in the corner or something, I'd make that call no matter what. And instead of asking them questions, I say, I'll make a call first. I better be safe than sorry. So pertinent medical information, whatever your history, if you did something recently, if that's not still getting down to the cause, you're like, why is this person still? What's the last thing they ate? And that's big. Some people go to a party, they eat too much. You go to Thanksgiving and say, oh, I got crazy stomach pains, and you ate too much. Or all right, we'll get you to the hospital. And then the final thing, let's see if I can remember it, is the events leading up to what happened, which I said that maybe they overate. So the events leading up. So this is the last thing ate. And the event. It's easy to remember after you do it. It's really a good tool when you assess somebody who needs care. Because sometimes they don't need care. It's like you ask these questions and they just shake it off like, no, I'm all right. I was just a little dazed. But if you go through this whole thing and it's still, you don't know what the cause is, and it's like, and they can't communicate it, then it was good you made the call. So now we're talking, that's what we use to assess, but now we'll also talk about what different types of first aid situations we might come across. Am I talking too fast? No? Am I good? Please, I have to ask some questions. Okay, good. I'm moving along pretty fast. All right, we're doing good. So if we come across, what's a situation? I'm gonna give some situations. I never remember all of them, so I have to look here. Gotta go in the notes. All right. So let's go through situations. We come across a situation, and I always do this one. It's like someone's on the ground, something sticking in there, whatever. They got something protruding out their body, and we come across this situation. They're alert, but they got something there throbbing in their chest. What do you do? I see blood, and then I look and I'm like, oh man, like blood hit me in the eye. What do I do? What's my first thing I should do? If you have gloves, you put them on. You saw blood, right? And then, bleeding. First thing we think, pressure. Put pressure on. Stop the bleeding, no matter what. So we have gauze. Usually, if you're a first responder or you're in the medical field, there's some gauze around. I just had one. Any gauze. I'll just grab this packet. So you had any gauze. If you don't have gauze, t-shirt, a sock, a jacket, anything that you could throw on that wound, because seconds count. I was talking about everything and I'm doing it slow, but the key is you don't want to panic. But you want to take a deep breath, but you want to move like everything. Every movement has to be efficient. So you see from a distance, it's like, okay, you see that blood squirt, now you put gauze on it. Once that piece of gauze goes on there, you put your hand on there, and that's in there. What do? I pull this out?
No.
Oh, you bleed that bad. You never take out nothing. It could be, there's horrible stories where kids fall on stuff and it's like in their nose, and leave it in there. You pull that out and they hit an artery or a vessel, they'll bleed out and die right in front of you. It's crazy. You hear stories like, should never touched it. So, and they'll try to pull it out. You got to let them not. But you put some gauze on it, stop that. Pressure is number one. After pressure, make sure they're not pulling it out. Once that gauze goes on there, we never take it off. We never check again. Yeah, some people are like, oh, keep checking. Is it still bleeding? And the person bleeding death. So this might not be in the face. But anyway, that's the key thing. Once you put a bandage pressure on there, keep that pressure on. Now, if that needed to stay there, I would take another piece of the wrapping gauze and I would wrap. Okay, I'm sorry. Let me go back. If you put that gauze on there and it bleeds through, you see blood coming through, what do you think you do? You got to keep the pressure on, and you, like I said, you never take this off. You just put another one on. Yeah, I don't care if you come and there's a stack like this. You know what I mean? And you just keep wrapping them on. So I didn't show you. Once you put that gauze on the head, if you had a strip of it, it's in here somewhere. This type right here, this stringy gauze right here, usually comes in a roll. I didn't have it rolled up. I'm gonna clean this up. But you take this and you stabilize it by wrapping it around the head. And like I said, if it bled through, you just add another one, you add another one, you add another one, and you'll be fine. So, and just wait till the EMTs come, keep them calm, don't let them pull it out, keep that pressure, whatever you got to do. It could be, so I'm going to go in another scenario, it could be in the body as well. And it'd be the same thing. You're trying to pressure on it, or you never pull anything out, and just keep it. I was a party at MIT, 17 years old. I'll say it. And the guy who I was with, we were in the party, and next thing you know, fight breaks out, and this guy, he's a trooper now. Damien, you know real shit. I'm from that. I'm sorry, I'm just because I know people, they know. So we went to the party, and this guy gets stabbed. Damien got stabbed at least 6 times, and the knives was sticking in him. So you panic. His friends are with him, and what do you think the first thing they did? They pulled out the knife. And I'm 17, and when they pull the knife out, this is graphic, but his lung popped out. Yeah, man, I'm like, what? And you see that, like, whoa, no PTSD for that, nothing, no counseling, anything. That's just in my head, like, true story. And so he pulls out, and I'm like, oh, and you see his lung, the lung is going, it's breathing still, and he's a tough guy, he's a trooper now. He's sitting like this with knives in him and his lung coming out. State trooper now. He's a tough guy. He's a good guy.
They saved him?
Yeah, he lived.
Oh.
So, but it happened so fast, and we didn't know. You leave the knife in. You don't pull the knife out. Yeah, you put pressure on there, and it looked bad. But there's another story I didn't say about the choking. There's 2 of them just to show you why this stuff is so important. I was gonna go back because I missed some stuff. Oh no, I'm doing choking next. I'm sorry. So the next thing we're gonna do is choking. I have a bad story to say. I'll show you choking first, and I'll tell the story. So that was one scenario with wounds. If you have blood, you pressure, bandage, and of course you call first, and you make sure that you don't remove whatever articles in there. Just keep the pressure on. The next scenario, say we came across someone who's choking. How about that one? What's a sign of choking? Sign and symptoms. Oh, I erased it. Sign and symptoms of choking.
Yeah.
Yeah.
Gasping for breath.
So that's another one where you got to get consent, because some people get embarrassed. I mean, they said that some people will choke, die slowly choking, like, "Oh, I'm okay," and they go over and go in cardiac arrest. They're too cool to get help, you know. So you have to ask them, because then and you see somebody, you'll know they're red or blue, their eyes, you'll know they're going through something horrible. So you see someone like that, you got to get consent too, because if you just came behind them, grabbing on them, they're panicking, you get into whatever. So eye contact. Are you okay? I'm okay, whatever. I mean, are you okay? If they say they're not okay, then you say, all right, the first thing you want to do, I'll say this to the person, they're standing up. You guys see that? They're standing up. So you got this person, they're choking, they're sitting there holding their neck, they're looking over, oh my God. And they, no noise maybe, I don't know. If they're standing up, I want to take my hand, if they're here, put it on the shoulder right here. I want to lean them forward. And my body should be sideways to this. And 5 hard. 1, 2, 3, 4, 5. You're looking for something to shoot out. You got to do it hard, because, that ain't got to do nothing. Yeah. You bang that as hard. Not bang it hard. No, you don't. Sorry. Let me take that back. Don't bang as hard as you can. You bang it as hard as you know that you're giving enough impact to make someone's lungs want to heave up some air. So, yeah. So anyway, you do 5 of those. Check on them. It didn't come out, you move this way. Stand them up. Get behind them. Take your fist. Make a fist like this. Get up in here, right underneath right over the belly button 1 inch, right underneath the diaphragm. Take your other hand, put it right up under there. You're going to squeeze them like you want to, like you just, and you pull up at the same time. You want to go up and under, and that makes their lungs go up. Now, remember that scenario I told you about 500-pound people? Mm-hmm. That ain't going to work. Your arms ain't going to be able to go around a 500-pound person, but you could lean them up to a wall. If they were finally like, and they're choking and they're still holding their throat, you put them up to a wall, you look for that same area, and you just give them some power there. You might throw up on you, I don't know. I want to go up under them. But somehow, whatever's going to come out is going to come out. But you want to force under the diaphragm. Fist, put the fist 1 inch above the belly button, right under the diaphragm. Lock this hand under and squeeze up and under. Yeah, fast though, like 5 of them. 1, 2, 3, 4, 5. Nothing came out. Person's still standing, still conscious. Grab that shoulder again. Go back to this again. Keep doing that till the piece comes out. Yeah. If it doesn't come out, they're gonna faint usually, and then we go into what? They usually go into cardiac arrest, and we start our
CPR.
CPR. That's why we learned the CPR. All right. Choking questions? I want to do a baby choking too. Let me show you the baby. Pregnant lady, you're so smart. Exactly. Okay, so imagine there's a big belly here. So you'd go above the belly and right where you think the heart is. And when ladies are pregnant, their breasts are like huge too. So you don't go under the breast, probably. Under the breast, right there in the middle. You don't want to squeeze the baby. You just want to squeeze the top of the chest and try to get it out. And that's, you try your best to get it out. That's hard. That's very difficult.
Yes,
Thank you for saying that. Yeah, for the pregnant woman.
And if it is the person, let's say someone is in the house and they are choking
By themselves?
by themselves.
There's a way to save yourself by yourself, yeah.
Yeah.
How do you save yourself by yourself?
How?
Yeah.
I would go to a chair.
There you go. You go to the back of a chair or something like that. If you were. Self CPR. And what would you do? You throw this is a wheelchair, but you throw your body over it. Anything that make you and you get it out, That's it. All right. That's good. Thank you for saying that one too. Pregnant ladies above it. So let's go to infants. Wow. Now, God forbid. You got a little baby. All right. So you pull up. The mother has a baby. The baby's choking. All right. So we're going to do, they showed us if you have a chair, anything, or you can get down on one knee. Babies are small. I'm going to take, there you go. There you go. Babies are small. I'm sorry. You're going to take the baby. You're moving fast. You're gonna make sure the airway's clear. Again, you might not have time for gloves, and baby's nothing's coming out. Baby might be alert, choking. I'm sorry, the baby is moving, is alert, choking. You're gonna take by two sides of the head here, like that. Some people are like, "Oh, get him!" And I was in a class and they had a baby like this. That ain't gonna work. You know what I mean? Yeah, it's like you're choking them even more.
Yes.
Another thing is they have the head was like, they left the head like that. You can't leave the head down like that. So you're gonna use your hand underneath. Oh, let me start over. So usually you grab them like this, keep the head solid. I have two boys, and then you grab the ears, side to side under the jaw, turn them over like this, making sure the head stays up. All right, you got that baby like that. Once it's the same pounding, but it's a baby. So the stories where they pound too hard, and so you got to do another 5. 1, 2, 3, 4, 5. And you look if nothing's happening. You keep repeating that process. 2, 3. I don't know how hard to go, but I mean, because it's enough, but not enough to do hard. You're just trying to. I would do more of a squeeze up, and you're just trying to get whatever's in the throat out, whatever. And then you keep, check in and see if it came out. And you do that if the baby lost consciousness, you go and CPR, yeah, that's all. God forbid, but that wouldn't. All right. Another thing I didn't show you really quick. So when I use the AED machine, going back to the CPR. When we use this machine, if this is available in CPR, going back to CPR, this is not choking. These pads, you put one on the front, you take off what's on the baby, make sure the baby's dry. You put one on the front. Sorry, I just want to show you. Oh, it's all right. I didn't drop the bed. There's one on the front, and you put one on the back, like that. And then you press the button and listen. And you have the baby down, of course. You get away, and then you follow. But it'll be lighter. It'll tell you what to do, and you do your 2 fingers in the middle of the chest between the nipples, 30 compressions, okay? It didn't say when you use the AED, you're not doing breaths before. You're doing anything. It would tell you. This one didn't tell you. Just listen to the machine. The AED is prioritized, and then the human, if there's no AED, the human practice is recommended. So, and I was just showing how to put the pads on the baby. One on the back, and the middle, one on the front. You all understand that? Sorry. I'm killing 10 birds with one stone. So that's it. Okay. So that was choking, and choking for a baby. You understood that? How we clean it out. Grab underneath the head. 1, 2, 3, 4, 5. Heads lifted up and back. And we try to dislodge whatever's inside. That's all. There's no Heimlich for a baby, of course. Too small. Let's see what else. So, okay, I'm going to go on to another scenario. This is another first aid scenario of a conscious person. So we did let's see, my memory's best. That's why I have a list. Oh, we did blood, like if somebody had a wound. Let's do how about a burn? If it came up in a burn, what's a sign? So the sign and symptoms, I erased it, but what are signs and symptoms of burn? How many types of burns are there? 3 types of burns. All right. So that's how we can figure out, because this is a conscious person who needs care, and we have to assess, it's a burn. So it's like, all right, so first degree burn is what we're going to see. Sign of first degree burn, it's not that serious. They get them in kitchens all the time. So, yeah. It's like a redness, might blister. Maybe, maybe not. If it's red and it might blister, then you go to ask the person, do you think you call? If you don't have to call. You'll look and assess it. And if they're just talking about it like, it hurts, the first thing, what do you think we do to a burn? Water, cold water, 15 minutes of continuous cold water on a burn, 15 minutes. So, if it's a first degree burn, they might opt to not want to go to the hospital. All right, go on your way. Fine, you didn't call. You just said, they have first degree burn. They can go if they want. I would recommend they go. But second degree burn is much more visible. Why? I mean, what is it? Second degree burn? What would it look like? Blister. It would have a blister, or you'd see it. You'd realize you'd see it, and the person is not going to be calm. They're going to be like, they'll be in pain. So they got to go to the hospital. What do you think we do to the first degree burn as well? Water. If they want water, you could do water. So you do water for 15 minutes. You could
For
touch-
for which one?
for the second degree burn. First and second degree burn, you're gonna do 15 minutes of water, and then if you have gauze, you take a piece of gauze and put it on the outside because the skin's open, so you don't want like dirt getting inside of it. But you can't really do much. God forbid you come across third degree burn. And you're gonna see that you'll smell that, you'll see that, and the person probably be in such shock. You know, it's like, yeah, this skin's gonna be melted off. You'll see it. Yeah. It'll be horrible. So you can't do much for them, but keep them comfortable and call. I mean, yeah, it's one of the things you just can't do anything. There's another type of burn. I do hair. I'm a licensed hairstylist, so it's another type of burn. When I do hair, sometimes it happens to my clients feel very upset. I didn't mean to do it, but it's the product, you know. I don't do it anymore. I don't do any chemical. But chemical burns. So you could come across someone, and a lot of them are made out of like this powders that could burn you. So you might come across someone laying in a pile, and the only thing you can do is, if it's a powder, you don't want to put any water near them at all. So they already have powder all over them, and it's burning them. You brush all that powder off, or get them out of whatever that contaminant is, powder, whatever it is. Get as much off, and not get it on yourself and breathe it too. That's one thing. Be careful yourself. If you can't get them off them, just call. But if you can get a broom and get a lot of the stuff off them, and then you use water to get the residue, the very little bit off you. And of course you call them the whole time. They'll probably be anything. So that's other than chemical burn too. All right.
I have a question.
Sure.
The third burn, what did you do for it? Nothing, just leave
You
there.
can't do it. Their skin is burnt. I mean, I don't mean to laugh, but it's like, what could you do? Yeah, you just keep them. They could go into shock. So yeah, you just keep them. You gotta call and just keep them. That happens, man. Oh, Richard Pryor. Remember Richard Pryor? The comedian? Ran down the street on fire? No? Oh, y'all, okay, that's a long time ago. I'm old. All right, well, anyway, it was a comedian who lit himself on fire, and his whole body was burnt up. So I did burns. Let's do another scenario. How about if we ran across someone who, you ran across them and, you know, you look and there's a bone sticking out and they're on the ground holding it, yelling, what do we do? Or even their leg. If they're laying on the ground and their leg, something happened to them. I can do this so I can show how we wrap this up. So they're laying on the ground and they're grabbing their leg or something and a bone sticking out. What do you think we do? Call first, if we can call. Or you might be in the middle of the woods or something and they broke a leg. So should we pick them up and move them?
No.
What can you do?
Well, we might have to get them out of danger somewhere, but that's not really, you know, like you make that decision. Is it safe to, you know, but call, and if that bone's sticking out and you could somehow immobilize it, try to just keep it closer to the body. If there's an arm, it was an arm and you had a shirt, anything. I'm going to use this bandage here, but you keep it close to the body. So this is my jacked up arm here, and I'm going to take this. If this I'm the person, I'm going to take this around. All I need is something to keep it immobilized. So maybe you use the neck, whatever, but it'll keep the weight off it. Yeah, that's a real simple one. You tie that, you know. You might be able to do that yourself if that happened to you in the woods. You'd be able to but anyway. So the first thing you do if there's any type of major bone injury is keep it immobilized. Because if you move it around, you could cause a lot of damage. It's a lot of pain. You called, and we're just waiting to keep the person calm. So you'd immobilize any broken bone. You're immobilized with a bandage. Let's see here. Asthma. If you come across someone, that's happened a lot in schools. As a kid, somebody with asthma. What do we do? It's the same thing. They're like, with asthma, you know, they're not choking, but it's like choking. They're like drowning in fluids in their lungs. So, what do you do with asthma? Ask if they have. This is where we go back. Sorry, I took it off. So it's a sample question. What's the symptom? Wheezing? Okay. Allergies. Asthma. You have allergies. Okay, good. Do you have any any medications? Yeah, I have my antihistamine. Get it out your pocket. Come on, let's move. You know what I mean? Now here's the catch, though. So here's the liability thing. We can't give anyone medication. No, but we have a course here that you can give people medication. Not trying to sell the course, but you can take the MAP program, and then anytime someone has medication that they have prescribed, you can put it in their mouth, or squeeze it. But if you don't have it, we can't squeeze it. But here's the trick, right? Get it in their hand. They'll be panicking, and you say, "You ready?" Squeeze it. As long as you squeeze it down on, and they knew to squeeze it, so you're not liable for anything. But you cannot give anybody medication unless you're authorized to give them medication. So that was for asthma. So you give them that, and then you call. Of course, we call first. Yeah. And it's like, and time is everything. Time is everything. People die from asthma attacks. It's like, seconds count. When you get that antihistamine, opens up the lungs, brain gets oxygen, body calms down. Beautiful thing. Let's talk about diabetics. Those jerks. That's me right here. That's why I said that. I'm diabetic. Oh, there's so many symptoms of diabetes. It's crazy. But this is someone who's incapacitated by diabetes. I was incapacitated by diabetes recently, 2 years ago. I went to the ICU. My sugars were high. So let me tell you the symptoms of that. Because it's not fatal fast when it's high. It can't kill you fast. It'll kill you slowly. But if you met somebody whose sugar was high, they'd be really cranky, thirsty, urinating, might be confused, but angry for no reason. I'm a nice person, but when the sugar's high, I'm Satan. You understand? It's so serious, it keeps me from my kids. Because they know I was going through some stuff, and it's like, dang, I don't get it. But it's real talk, because 3 out of 5 people have diabetes. So you're going to meet somebody who's going through something with diabetes in your life. It could be your grandmother, mother, hopefully not y'all. I hope y'all don't eat bad food. But so you come across them, if it's high, you can't really do much for them except say, do you have insulin? Or you have your glucometer? And then they can take it. They usually used to taking it. You check it. If it's real high, we can't give them the insulin. But put it in their hand, you know what I mean? And say, all right, you ready? And then they let, stick it. But we have a MAP program. You could get certified to give medications, and you don't have to worry about it. I forget how much it is. Like $450. Cheap. So that was for I'm moving slow. That was for asthma. Diabetic. Me. There's another sign of diabetes. So what if you go? Maybe I'm hypoglycemic. So that's when it goes low. That's dangerous. That's when you sweat. Yeah. Oh, that's the worst feeling in the world. Worst feeling in the world. So what's the sign of that? What do you think the sign of that is? Confusion. Number one. I didn't know my name. If my sugar's low and I have to open that door, I don't know how to open the door. I look at it and be like, hey, how do you open the door? And you're looking at it like you don't know the turn, So that's how dangerous it is when it's low. So you'd see sweat, profuse sweat, confusion. Well, they might pass out. So, but as long as they're awake, and if that it's diabetic, if there's candy, give them a piece of candy, put it in their mouth. It'll bring it right back out. Yeah. And you should know by checking it. So you see them sweating, if you have time, check it. But yeah. So that's it. And it's the worst feeling. Yeah. Mine went low so many times, it's like, I never want it to happen again. I'd rather be high than low. Yeah, low is terrible. You feel you're dying. Your body's like, I'm gonna die. Let's see, what else we got here? Seizure. What happened if you do a seizure? I'm flailing around. I don't know how it happened. I don't know, whatever. But what do you think you have to do? Yeah.
Make the surroundings safe.
Make the surroundings safe. Yeah. You pull everything out the way. Some people like, grab them, hold them down. Get them, don't touch them. Pull everything out the way. Other people in other cultures put a spoon in their mouth. Or anything. That's crazy. All you do is gonna break out their teeth. It's like, the tongue is soft. They bite their tongue. It's like, you get a stitch, you can fix that. But you're gonna give them $3,000 worth of dental work for nothing, So never put a spoon in their mouth. Clear it away. They can flail around. It'll be over in a couple of minutes. Call. Get help. If they have the medication, where's your medication? Put it in their hand. Let's got the map. There you go. I'm moving. Hold on. I'm getting there. You need a break? Any questions? We'll go with this really fast. So about stroke. Stroke. My dad has 6 strokes. We didn't know. He's so cool. He wasn't like saying it. I don't know. But 3 of them they caught. But then he had a scan. There's 6 up in his brain. It's crazy. So Anyway, I remember when he had one of them, and there was a signs. There's another one of these things that help you remember for stroke. It's very important. It's called FAST. All right. You remember what it stands for with stroke? FAST. So what's the first thing usually when you meet somebody, you look at their face. So the first thing you might see, I noticed with him, is it looked like just somebody just took this and went, yeah. And I was like, what the hell? And he's like, well, you know, and then I saw that's the next thing. Well, this one's for arm, but there was no, with him, there was no real arm thing, but he reached for a cup and he was reaching over here. And I was like, oh shit. You know, it's like, whoa, what was that all about? And he was like, yeah, I see the cup over here. So, you know, something. Yeah. So that was his, that's kind of arm. Face is the first sign, dragging. Arm would be, on most people, it just, my grandfather had a stroke. He's a monstration machete. My grandmother was telling me he came in with a cutlass and he was carrying something and just walked in the door and went like that, you know, carried him up to his bed and he died the next day, I think. Now, I'm going to go back to the, so speech is another one, right? But here's the thing. So that's why I said they carried him up to his bed and he died. Time. You don't want to carry anybody to no bed when they're having a stroke. You call, even if they think, because most people don't even know they're having it. Most people are like, they're just like, ain't no wrong. My dad was like, ain't nothing wrong with me. I'm going to go lay down. You go lay down. Okay, look at your face, man. So time is everything. You gotta, don't guess it. A lot of people have strokes. We eat a lot of salty food, high blood pressure, stress, muscles, you know, it break easily in your blood vessel. So time's the key. It's time you gotta call immediately. But look for the face, arm, speech, and then time. If they get there in time, there's a drug they give them within half an hour. It will stop. I don't know if it clots or did something, but stop the bleeding, save brain tissue. So time is everything. Don't let them lay down. You'll have a client and they'll say, well, I'll just eat something and feel better. Nah, something's wrong with you. Your arm's hanging down. It's like, come on. Okay, a little water. So one more. Hold on. Sorry, I'm trying to move this fast. How about, we said allergic reaction is the same as, they swell up with an allergic reaction. And there's something. So allergic reaction. Somebody eats peanuts or shellfish or something they're not supposed to eat, or latex gloves. You got to be careful with that too. And they say, oh, they're swelling up or whatever the reaction is. They usually have something like this. It's called an EpiPen. Yeah, where's it at? There you go. They have an EpiPen. So this EpiPen they'll have, we can't give them the shot. But what we can do is assist their hand, put our hand on top, and this thing you just, pow, one time in the leg. So you just help them put that in. They'll be fine. Call, of course, and yeah, that's all. They'll have to have this. You can't like give somebody, they have to have their own medication. We can't give them medication. Yeah. So they have the EpiPen. That's for allergic reaction. And you'll always call. It could be swelling, it could be hives. Yeah. And you don't have to call an ambulance, but I mean, I guess for that, all these scenarios, you have to make a decision to. No, well, except stroke, you always call. But I mean, some of them, if someone has an asthma attack and you gave them the inhaler, I mean, if you called already, but if they're already fixed, there's no need. They won't get in the ambulance anyway, but they already got repaired
I
from.
suppose you don't have any like in the. So what can
That's when you have to call because there's nothing. They'll be sitting there suffering. Call the paramedics.
Nothing you can do while you wait for paramedics to come.
For if they didn't have an inhaler and they had asthma, what would I do? I don't know. That's what I'm saying. I don't know. That's what I'm trying. But you should be able to do something.
That's what I'm saying.
What makes it? I mean, I'll tell you something I did the other day, and it's not. I teach to the American Red Cross standards, so they don't tell us some of the stuff. I'm just saying out of my head, but I'm teaching you the basics for to get certified. But then there's just extra things. I don't know if there was boiling water and you put it under the nose. Doesn't that make your lungs open up? I did the other day. I was real congested, and I was like, I had a cup of tea, and I said, and it just opened my lungs up. I said, it's a nebulizer. It's like, but you don't have to get the nebulizer. You just need a cup of tea on your nose with some steam, and it'll open up with a little mint in there. So anyway, I did that. It worked. Maybe that will work. I don't know. I'm not into medications and stuff. I like the natural approach. So I know there's always something natural that you can put that will do the job of something they put in the pharmacy that will mess you up later on.
Well, at one point, I heard that this not long time ago back home, somebody gave.
Where's back home?
Jamaican.
Okay.
Somebody
I know
gave
I like you for a reason. I'm saying good people. Like I'm from Montserrat, so it's like a tribe. Go ahead.
somebody gave the person a paper bag. They gave
Yes.
them a paper bag, and they keep blowing in the paper bag.
Wait. Yes, I'm so sorry. It's in there. The paper bag is in there. God bless you for refreshing my memory. The paper bag. So if I think that works sometimes. It's
Well, at least you try.
at least you try. So that they were going into. So I don't know if that works for asthma, but hyperventilation, it could work. I'm so sorry. I'm gonna research that one. But yeah, that's what this bag's in there for. If you have a bag somewhere around and someone is going through some type of respiratory issue, and it's asthma, you can't hardly breathe. But maybe I'm gonna look it up. But they did say use a bag. Try the bag if that doesn't help, and you don't have anything, then you just try to keep that person. It's like they're drowning, right? It's a terrible feeling. Yeah, it's crazy. Keep them calm. Keep their heartbeat down. That should save some oxygen, make them feel better. Say we're getting the EMS is coming, we'll be all right. And try this here. You bleed into the bag. Okay, I'm sorry. So what if we came across somebody and they were really hot, heat exhausted? You go to a game and there's people on a soccer field and you meet somebody laying on the ground and sweat all over them, and they're awake, but what do we do?
Give them water to drink.
Immediately. What if they're wearing is a person wearing a big coat and there's a pool. Exactly. But take the coat off, man.
Yeah.
And give them water, and you could also fan them. Yeah, that's the one thing. Now let me go into the bad story. I don't like bad stories, but I tell these stories so people realize how important this is. So my first class I went to get certified, there was a brother from Nigeria, and he said when he was 16, he was at he stood up and told a party, and he told a story and he started crying. So I was like, and he said, I'm here because I was 16 and I was at a party and my niece was blowing up balloons. And she blew up the balloon and then grabs her throat. The balloon disappeared. So they were like, oh, okay. She can't breathe. Give her ear. They get these things. She's on the ground. They're doing this. Girl's choking at them. You know what I mean? Like, yeah. So they're thinking. And then they said, instead of calling, we could get her to the hospital faster. They put her in a car with somebody in the back doing this. So all she's doing is just laying there choking. So that made him. He said if he would have known how to just clear, she went into cardiac arrest, anything. He said, man. So he'd make sure he's certified every 2 years, and he knows. So that's the story. It's real. It's like you can save life or you can sit there helpless. I have another story. I can tell stories all day. But y'all get out of there. There was a heart attack guy I couldn't help, and I was like, that's one before I knew this, and I was like, now in retrospect, I'm like, damn, I could save that man's life, But we stood there for 5 minutes waiting for the ambulance while he's having a heart attack, dying. So going into heart attacks, what's the signs of a heart attack?
Pain.
Close the dude up. Yeah, you're gonna grab your chest. You're gonna say something's wrong. Chest, the arm again. It won't go limp, but they'll say, "Oh, I got pain in my arm." It's usually the left arm. Women sometimes grab their stomach for some reason. They said, like right under their heart. So different signs. There might be some sweat, confusion.
So every pain in the arm has to do with the heart?
I think because we have these big blood vessels, the body just recognizes as something's messed up around here. You know what I mean? It just there's these big vessels.
So not overworking the arm could not cause pain in the arm.
It'll be a different pain because shortness of breath too. So if you were overwork your arm, you'd be like, I overwork my arm, but I can still breathe. This is like my arm hurts.
Okay, so if you can't breathe.
Yeah, you can't. Or you could make it breathe, but it's like
tight.
You're gonna have something's wrong. You know something's wrong. You'll be like, it's not the arm. Okay. So what do you do for that? It's time again. You'll see the signs and time. Don't guess. Call. They say sometimes, like I said, the person will say, I'm fine. Wait, I'll sleep it off. And you call them, they picking them up the next day. You know what I mean? Like they just didn't make it. So always time. Always call. It's just one of those things. It's easy to call. So how about cold? Somebody's really cold. We did hot. Give them tea. Oh wait, even before that. Yeah, so they might be cold because they fell into a pond. Dry, warm. You know what I mean? Blanket, call. They could go into shock really fast too when they're really cold. So like now too, especially this weather here. Yeah. People drinking New Year's Eve. You always hear about somebody dying, like they find them New Year's Eve, the next day, frozen to death somewhere. So you keep them covered with a blanket, call, hot tea, dry, you know, and watch them because you can go into cardiac arrest in a second. I think we did all of those on here. Let's react and hot. That's good. It's first aid. We're almost done. What else we got? Hold on, let me check. I'll be right back. You want a break? You want water? Something? Bathroom?
Yes, I'm going to do
Yeah,
that.
go ahead. I'll turn this whatever and then let's see. All right. Face, arm, reach. Am I talking too fast? We're good.
Oh, good.
And we're gonna do some testing on the mannequins. I have the patterns down here so we don't mess with our knees. Because it's hard. I try to do it. I'm like, yeah. And in a real life scenario, there ain't no pattern. It's like, how you just gotta get down. Yeah, so I'd say if you had a jacket, if you have that, you know, that resolve to think that fast,
anything.
just so you know, because you're not gonna be able to, man, on this, oh no. No, not these old knees. Right. Oh, yeah. Any question? Oh, she's coming back. No? It's good.
Just relax.
All right. Let's relax. I talk too much. Okay. It's Saturday and Sunday, so wait, I can drink some tea now. I got no sugar. How long you been nursing for? Oh wow. And you like it? They don't treat nurses good sometimes. No. They don't appreciate them.
They don't pay, they don't
Yeah.
treat you, they don't appreciate you.
And that's, you know what's funny?
Really commitment, you know.
When my dad got sick, I didn't praise the doctors. It was the nurses that made everything happen. They're the ones who told me, like, stuff that would, you know, make him better that the doctor wasn't saying. They pulled me to the side. They were like, yeah. They were like, hey, by the way, if he takes this medication, it's going to make this worse. They tell me, and I'd be like, the doctor never say nothing. Crazy. So I appreciate you. Hard work. Very hard work. And you're on your feet a lot.
Yes.
And people are grumpy. You know?
Especially, I work in a nursing home.
Yeah.
Geriatric.
Yeah.
So,
They're very cranky. Yeah, bossy. But they're in pain too.
Yeah, you understand.
Yeah.
But they are very nice. They appreciate you.
Mm-hmm.
So sometimes when the patient is good, and it was the parents, you know, the family. They don't have to
I
do
heard about
something
that.
Yes.
They come in and it's the one time they might see like a little something spilled on the shirt and they say, y'all want to take care of my mother? She has chocolate on the shirt. Like, yeah, I heard stories like that. They yell at you for nothing.
Yes. Somebody fell. Anybody can fall, but
Right.
we try not to
Not
happen.
to,
But when it's happening, you know, so you have to do anything.
A
You have to
report.
call them to tell them. And then they're so upset. And
Mhm.
you yell at you, how come? And if the person was in the house, they would fall anyway.
Exactly.
But, you know, for you, it's supposed
It's
to.
your fault. You should have seen it. Crazy.
And you can at least spend there, you know, if they want to spend, sometimes they do want to run, but sometimes, you know.
Yeah. The Alzheimer's, the
staff,
dementia,
yes,
you have to deal with
always,
that.
yes.
Yeah. Patience. Like I said, you appreciate it.
That not for the money, you know, because they don't have enough money to pay for what you do.
Right,
But you
yeah.
know, if your heart.
Yeah.
And then so today is them, tomorrow will be you.
Right.
And your family.
Right. Everyone's gonna get old.
Yes.
Yeah.
Yes.
Mm. Tell people take this course because, like you said, everyone's gonna get old. Or like we said, but you're gonna go into a nursing home and they'll take your house from you. But if you have somebody certified in your house, I can say that on this. If you have somebody certified to take care, I did it for my dad. I wasn't getting no check for it.
Yes, longer in your
Yeah,
house.
so it bankrupted me. It's like you can't go to an appointment. You'll be there for 8 hours an appointment, no pay. It's not your appointment. It's like, you know, it's not a child, but yeah, but it takes your whole day, and you can get paid for that if you got the CNA certificate. I didn't know it. Yeah, so I tell people to do it. All right, everybody, I talked too much. So where are we right now? I'm supposed to find out what I was doing. So we went through. We have to do some testing on the mannequin. Just really quick. It's not gonna be a lot. First aid, AED. I did child CPR, child choking, adult choking, and we are going to do. I think that's the majority of it. We usually testing on the mannequins. 5 sets. Do you remember? Who wants to be the first scenario? I won't film it. I'll just whatever. I'll put it down like that. Who wants to be the first one to come in the door and find people on the ground, you know, and do a run through really quick? You ready? There you go. All right. Scenario is the body's on the ground. I'll move it so, and you can use this cushion to lean on it. Okay. Action.
I come, I see someone on the floor like this. And, oh, there's something. Hey, you okay?
No answer.
No answer. I look around.
Yep.
If there is any hazard,
Mm-hmm.
any problem, and I come.
The person on the
Yes.
top.
Hey, you okay? No movement, nothing. And he's in trouble. But before I continue, I pull my phone and I call.
First thing, yeah, it's a call. You got that phone call. Anyone on their back, you should call. It's like something's wrong. You shouldn't be on their back. Yeah. Okay.
So, sorry. So you do all of that before you call? Do all
Well,
of that
first,
check-in?
so I want to see what it is. You see from a distance,
There's
and
someone
before you
on
can
the
call
floor.
it them. I mean, you can yell, "Hey!" and say call at the same time. No, I have to teach this. I know. I'm sorry. But next week. All right. So where am I at? I don't know.
So you come through the door.
I came through the door.
Right.
First thing you do is you're gonna call,
Oh,
and
You saw
yeah,
the person on the floor, so you called.
yeah, because it just looks like whatever.
key, the bathroom key?
For men, I always
Oh,
do
the
that.
ladies, okay.
No, I wouldn't take the ladies one. I had the men one.
So the door was open a while ago.
I always take it, but I didn't take this one. No. All right, I'm sorry. So the call-ins first, and then we're going. I'm sorry. Let's see.
You come through the door, you saw the person on the floor.
Yeah, and you
You
call.
called.
You call because they're on the
Say,
floor,
"Oh."
and then
But
you
they
call
ask you
them.
question when you call. That's why if I will come closer before I call, but I don't know.
But even if somebody's laying on the
On the
floor,
floor.
yeah, I don't
It
think
should
they
be,
should be laying
lying on
the
the floor.
No. So
Something
I just
must
want,
have been wrong.
I'm saying I want professionals to come because I can't fix this person. But if they're not breathing, I can help them. So, all right, go ahead. So, yeah, first thing,
Call first.
call,
Okay.
safety, all right, and then action. And you're there. Now you have a voice, so you already called, but you want to see if they're awake. They might be sleeping. So what would you
Well, I checked them.
Mhm.
You okay?
do? You yelled already though? You said,
Yes,
okay,
yes,
okay.
yeah, twice.
Yeah. And then you tap, yeah.
Nothing.
All right.
So I
Now you gotta get
get
closer.
online.
Okay.
And,
We want to know if they're breathing.
I listen for breathing.
Mhm.
And at the same time, I look at the chest.
Yep.
Okay, no breathing. No breathing.
Mhm.
So I'm going to.
You can put on your equipment if you
Yeah,
have it.
get the equipment.
Yeah. I don't think I have to have you, but I can put it on the mannequin. You're not all right. There we go. It's not on you. It's just on. Go ahead. So right now you did the 10 seconds of checking the breathing.
Yeah.
Okay, good.
No pulse.
No problem.
And I listen. I don't hear any breathing here, and the pulse, the chest
Just is not
rising.
moving. Okay.
Yeah. So I'm going to start CPR.
And so how about the airways right now? Were they eating steak or anything?
Before I do, I
Big finger.
open.
Yep. You can tilt back at the same time because it'll open up the throat, but
Yeah.
you'll also be able to. Once it goes back, you can pull the chin back
Yeah.
down. Yep. And you
Okay.
look in there. If you visibly see something, yank it out.
There
If
is
you don't see
nothing.
anything,
If you don't see anything, yeah,
That's
you go right into your 2 breaths after that. But you'll
Okay.
pinch that nose how you were just doing that, closed and tilt back, and then the mouth
Okay.
will be open. You'll have your equipment on too and gloves.
Yes, always.
Okay.
I didn't put it on because they're sweating. You don't have
Yes,
time.
okay.
You'll always, yeah. We're not gonna, and you're not gonna breathe on the mat. No, of course not. Yeah. Yeah. You stay away from it. Yeah, we have to have. Remember, we always have gloves because in case of disease. Yeah. So you tilt that back.
Yeah.
The mouth's open, you cleared, whatever, and then just you act like 2 breaths.
Yeah.
1. Yep. 2. Did the chest go up? Did anything happen?
Nothing.
Nothing. All right, so what we gonna do?
So,
Get that fingers out first. And then interlace, yeah. And then your arm's gonna be straight over. There you go. We're gonna go down 2 inches and we're gonna go on the beat. Then you count 1, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. You count out loud. 30. You know, so now, okay, let's check and see what's happening. Anything happening?
nothing happened.
Check. Let's check. You have to check.
Okay.
Nothing's breathing. So we're going to give him 2 more breaths. Remember, 30.
Okay.
All right, tilt back, pinch the nose, open. Just
Okay.
1. You're going to give him big. Try to blow this up like a balloon. Anything happening?
Nothing.
Nothing. Let's go back to the chest, right in the middle. Hand out, put it down like you're trying to.
Okay.
Yeah.
On.
Interlate 2, 3, 4, 5. You say out loud. 7,
7,
8, 9, 11, 12 to 30,
14, 15, 16,
17,
17,
18, 19,
20,
20, 21, 22, 23, 24, 25, 26, 27.
28, 29, 30.
Anything happening?
Yes.
No. You saved him. He's breathing.
Yes. She's breathing now.
Yeah.
I use
But in this scenario,
Yeah.
in reality, you just keep going. Doesn't that take a lot of energy?
Until the
Yeah, it takes a lot of energy.
Yeah.
She didn't
Yep.
want to go any further.
You're hoping 2 people.
No,
Alright.
one thing I'm gonna ask, when she did, she interlaced, but she folded her face. So she,
Well, as long as you're getting the power in, I just left mine out.
I just need to know if it's
Yeah,
right.
no. As long as you know, though, it's like
when you do this, you do this.
your weight.
So
Your weight should be over it. Yeah, you show. As long as you get power here.
Like this.
If you're over like this, you ain't getting nothing.
Yeah.
It's like, yeah, you use
no,
it.
no, that's not what I'm asking.
I know, but the thing is, no,
When she's pressing against
it doesn't matter.
She do this or should
It should be locked together because it's stronger together. But I mean, it could be closed over. I don't. As long as you're getting that chest down 2 inches for 30 compressions.
No, yes,
I just need to
2 inches or more, 30 compressions on a big body. That's it. Or 1.5 inches on a small body. And that beat. But you got to count to 30 because you always forget. 1, 2, 3, 24, 25. That's good. 2 inches down. You keeping that blood to the brain. All right. Who else wants to try?
So when you check the carotid
Or artery?
Yeah.
you check the pulse.
For
After
the
you do
pulse.
that, you check the pulse and then you breathe again.
You don't even have to really check the pulse. We're gonna do a quick listen. You'll see if somebody's coming back because the heart always goes doop, doop. If you don't hear nothing, you know, like you don't have to wait 10 seconds. I know, like if his heart's not beating. I know in 3 seconds when somebody's not, you know. So that was very good.
Let me try.
You ready?
I have to. It's 3 of us, so
You got it.
we have time.
All
So we
right.
have to.
There you go. From the beginning.
All right. So
All right.
I come in, I see the person on the floor, then I dial 911, whatever. All right. Finish my call, put back my phone, and then I shout, "Hey!" No answer. So I come over. And then I tap. Hey, nothing. So what do I do? I get on my knees. Oh, God. Ow. I can't kneel. My knees are not too good.
You put on your personal equipment.
Yes.
Yep. Always be safe. So if you have it, if you're not, you just gotta roll it whatever. Okay.
So I don't put it on yet. Do I
Well, I'm
put
saying
it
if
on
you
yet?
have it, you
Yes.
put it on.
No,
Yeah.
but
'cause
if
remember,
I
there
am
might be
going
blood,
to
there might
check
be whatever.
and I'm gonna do this.
Yep.
And
Check
then
the airway.
yeah, check the
Clear it if you have to clear
Right.
it.
And then my personal
You're gonna throw your
equipment,
equipment on really fast.
Right.
The mask, pinching the
Right.
nose,
pinch the nose, and
lifting the head back with you. Yep. Yep. It'll be 2 strong breaths.
yeah, so strong, and then nothing. So
So
I
how about interlacing those fingers?
interlace the
Yeah.
fingers.
There you go. Right in the center of the nipples. Yep.
Mhm.
So you
Right,
look.
feel
Yep.
the nipples.
And then you're gonna put your arm is above it.
Mhm.
Above.
the
You know your shoulders above your hands, so you get
Oh, okay.
strength. Yeah. Yeah. Get strength.
All right.
There you go. And now 1, 2, 3, 4, 5, 6, 2 inches down. 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21,
22,
22,
23, 24, 25, 26, 27, 28, 29, 30.
Ah, check. It ain't happening? No. Tilt back. Yep, go ahead. 2 breaths. Strong breath.
Nothing.
Nothing. All right.
So
Back
we're
to the compression.
Back to basics.
Yep. Lock those arms out straight. Yep, you got it. Because it's easier. 5, 6, 7, 8.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30.
All right, nothing happening?
Nothing.
Pinch the
Nothing.
nose. Tilt it back. Open the mouth. Deep breath. Boom. 1, 2 breaths. Good.
Nothing.
Ain't happening? No.
Oh,
That-
nothing.
all right. It's a lot of work.
Okay.
Are you confident? You try it? Go ahead. And I think that's everything we did. I'll go the paperwork. I think you guys can save life. We'll see. I know you're watching. And your questions, I know you know. All right. Ready?
Yes. Ready?
Action.
I'm coming. Oh, look at somebody on the floor. I call 911. And then, hey! I come closer. I look up. They see how one thing is fine. I keep walking. Hey! Are you okay? Are you okay? Nothing.
No pulse. All we gotta do. Yep, you put on the gloves and on your face equipment and tilt the head back. What's the other part you gotta do with the nose? 2 strong breaths.
And I look at it. I don't see nothing. I don't
Nothing
see
happening?
anything.
Okay. See the chest blow up, big thing. Yep. 2. Nothing still?
Nothing.
All right.
Mhm.
Right between the nipples. So I always say just the palm right there, right between the nipples. And then the other hand is locked so you have both of them together. And then your shoulders above, yep. And then you're just going to use your weight. Come on. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. You can
25, 26, 27, 28, 29, 30.
Beautiful. Nothing happening? Keep going.
Nothing.
2 breaths. Again. It's a lot of work. 1, 2. You got to be pinching nose and stuff. All right, let's act like it. All right. I know it's a lot of work. Imagine, you know what I mean? 2. Chest went up. Nothing still.
Nothing.
You go right back. All right. All right. 1, 2. It's a lot of work, right? Yeah. I think you guys got it. 10, 11, 12.
13, 14, 15, 16, 17.
You put your arms more over. Let's make it easier. Yeah, 2 inches down all the time or more on adult. Little kid, 1 inch and a half or less. But that's fine. All right, say 1 to 30. Yeah, you got it. You got it. I know it's a lot of work. But that's the thing. You got to just keep the oxygen going. That's what the key is. I think you guys, I feel very confident that you can save somebody's life. I'm Brian Brown. It's the CPR course. I got a toupee on them. No, I don't have a toupee on. So those are essentials to saving life and first aid. I think you guys are confident. I'm going to go fill out paperwork. I feel if something happened to me right now, I'd walk down the street, I'd be like, oh, I feel safe that you guys are there. Hopefully nothing happened to me. I'm going to stay healthy. I'm just saying. But I would feel good. Everyone should know it. So it's good just to know these simple things. Because a lot of people die from silly things. Who is it? There's a rapper named Puff Daddy. His wife died from pneumonia, but she went into cardiac arrest. And it's like, I don't know. So things are happening to healthy people. So you got to know these skills. You can keep life alive. You just keep it. 2 breaths, 30 compressions. Pinch the nose, tilt it back, check inside. If you got it, get it out of there. Nothing happening. Palm in the middle of the chest. 30 compressions. 1, 2, 3, 4, 5. You know the scenario. All righty. Woo! That's it. Congratulations. We have lifesavers. God bless. My name is Brian Brown. 617-296-2700. Art classes, making clothes, all kinds of stuff. We're going to get crazy up in this piece, man. Movies, you name it. Bye-bye. Thank you. All right. Let's go get the whatever. So would y'all bring money orders or?
I didn't bring money.
Oh, you got checks. I could do. I mean cash. I could do cash. Yeah, cash is fine.
What about card? Credit card?
I could try. I could do it. I think I could do it. I have my phone. Let me see if I can do it. I'll tell you if I can do it. Cause it's cold out. I wouldn't have you running outside right now. PayPal here. Let's see if it works. I think it will work. I have to go. Oh yeah, it'll work.
Hey, this man, leave me alone.
I'll get your receipt.
Yes, sir.
I'll try. Let me try it when I go next door,
Yes.
and I'll get the receipt. And then what were you saying? What do you have?
No,
100, one piece.
You have a $100 bill?
Yeah.
Yeah, I think I can change that. Yeah. That's fine. I'll get a receipt for that too. And I think it's good. I'm sorry this room is so hot though. I thought it was hot. We're doing the physical work.
Yeah.
God bless you. I'll bring back your change and a receipt. 1 second. Thank you. I'll bring back change. Is the exact amount? Or?
yes.
Okay. I'll bring back the change and receipt. 1 second. Yeah. Thank you very much. Okay. Yes. Oh, name. I'll bring back the book and I'll write the names out and everything. I need it for the spelling on the cards too, so I can do it right here on this computer. I'll be right back.
Okay.
Non so io devi levare di
Ah, yeah, better to do that.
No, mbate ko kono no. Mbate ko.
Wow.
Moi $300 di. Fait qu'à $200.
Thank you.
Oh no. Oh, mais laisse-moi te dire 500.
Yeah.
I'll call you because I call you. I'm gonna look across the road if I see anything that is reasonable.
Même temps de bagay la.
And if I then
Nous
I have to
nous
go.
connaît na kudabde, bakon konya la pied.
I'll do that first before I go.
Simple plus.
All right.
C'est complété. Si toutefois ça va pas marcher, quatre là va pas marcher. Mais comme le ça fait pas tellement.
On va tellement bagay. Ça fait. On va et puis, oui. C'est que tout le monde bagay ça.
Non. Si nous pas comme ça.
Ma connaît. On sait de bagay on va faire si ça nous fait nous c'est un petit bagay pour nous ça la vie demander et puis le reste là il y a mon qui va faire
Non.
yeah pas dit même bagay l'autre encore sans comment ça mon là
Oui. Merci.
You two ladies work at the same place?
Yes.
Oh, I realize.
yeah
That's nice. Where is that? You mind?
Like,
Oh, help independent.
Right. St. Elizabeth Hospital?
no.
I don't know
Oh, that's nice. I wonder if that's the nursing home.
I'll be right
I
back.
am.
So,
Yes.
get back. I gotta get a pen. I'm sorry. I have to cry.
alors souvent mal prend comme là et il a dit qu'il s'en fait si ça m'utilise la donne
Oui.
ma connaissance là bas on CPR nous va faire gaspillage si nous connaissons nous avons besoin de nous bagay c'est nous devons bien là il a nous gaspiller
You get two? The card, you get two?
I didn't do it yet.
Oh, yeah. No.
I'm trying.
I didn't do it.
I just have to get the names too for
Yes.
the I don't do administrative stuff. I'm trying to learn. Not what I do. All right. I think I have to put something behind this. All right, so let's see. Oh, you came before, so you was yeah, I know. Yeah, and what's your name?
Doreen. Doreen. Grey.
That's simple.
Should I give you when you're writing the card? Would you write? I don't know.
How do you want it spelled on the card? Yeah.
No, I'm wondering it.
Wow.
I'm not sure what was on my certificate.
It's gonna say CPR AED.
No. I'm just talking about the name.
The name. What you got? An alias?
No, I had my middle name somewhere, but I'm not sure. I don't remember. Never mind.
So you want it? Hey, tell me how to put it on there. I'll put anything.
Let me just look what.
I'll put Doreen Superstar on there. You anything you want. But that's once I put it in, they don't let me change it. So go ahead, take your time. CPR AED first aid. From what's today's date, by the way? Sorry, today's
8.
Thank you so much. 12
What is it in Ghana?
Brian, that's yours. Thank you very much.
You know what? If you don't mind, I will give it cash. You can give me that day cash. It will be easier.
Okay, so this is
90.
9. That works out wonderful.
Yes.
All right, thank you so much.
Okay.
So then I'll get you guys, and I'm spelling the name. So that's all right, Doreen. DOREEN GRE. All right, that's yours. That's how it goes on the card, and then you're gonna spell your name out for me too. After I figure out how to work this. All righty. So what's your name again? You told me I forget.
Yes, let me give you that you will see.
All right. It's a difficult name. You said it was easy before. Marie.
Yes.
Yeah. But that last name, yeah, I never saw that
Yes,
before.
yes.
That's cool. That'll look like a clothing line name would be good for that. Calix. Wow. Calixty?
Yes.
Okay. 12. So she came to school before. That's why hers is anyone who comes to school before is cheaper. But even now, when you recertify again, if you come back 2 years from now, it'll be cheaper as well. Because you go through me. If I'm still here, if I'm not traveling the world, I don't know. I would never charge you the 85. 85 just for new people because we got it. But 85. Proceed from Murray. I'm sorry, my brain is slow. And I think we should be able to print everything easily. It's for CPR certification. What time is it right now, you know?
Yes.
Oh, sorry, we did good. We did really good, man. I'm telling you, I moved fast. They said 5 hours. I said, how are we going to sit here for 5 hours? No. And you guys did it good. So there's no, yeah, you passed them. 2 breaths, 30 compressions. Yeah. Clear the mouth, tilt the head. So you did, that's all I'm giving you is this, and then I got to go use the computer. I'm slow.
On my certificate that I got from here, it says Doreen M. Great.
I can put Doreen M. Graham. All right. Not a problem, Doreen. I'm going to rate that so I remember. How long ago did you get your certificate?
I just finished the other day.
Oh, you're just getting
I
everything.
got my
That's smart because then he
got
can't
my
stop you.
license.
Yeah.
Good.
And ask them about. I don't know if they pay more for the map or if they pay for it, but ask them if they pay for it because sometimes they want you to have that. This makes you more useful. The minute we don't have it yet, but we're getting recertified. It's a good one to have. Like I said, all those times when you got to give somebody a pill, you can't. I'm sorry I talk so much. What's your name? You gonna show me? It's Rosalind. Paula. That's it. Okay, Paula. This one. Oh, man. People out there just running at the mall going crazy right now. That's 85. Oh, my brain is slow. Paula. This is certification from 12/8 from 9:30 to 2 o'clock. That's 5 hours? No. We just move fast because you know it. Yeah.
And we like
Why
it,
sit
yes.
here wasting
Yes.
time? You guys knew everything.
Yes.
This is your old card, huh?
Yes.
We'll get your new one for you.
Yes, and we cover a lot of things.
Yeah,
Before
yeah.
we didn't do burn, before when we used to do it, we
You didn't do that part? First aid too. So let me go. I'm gonna go
I
print these
did
up.
I did one a long time back then. Yeah. And when I did it, I had to do written paper.
Yes.
So I asked him if I have to do written paper.
No written paper. So I'll print these out. I'll be right back.
And the truth is, it was very confusing.
Brian Brown. Yeah. I just started working here.
Okay.
Yeah. This is my 4th class teaching. I like it though. It's
But
good.
Brian, you said something. You said you are old. Are you old?
46. I'm gonna be 47 next week. So I'm saying I'm old because of gray hair. Yeah. I dyed it. That's what the thing is. I don't know. I
You're
feel old.
older than you.
What's that?
We want, I don't know
Because
about
it's good. No, it's good about
that
like
we
black
people are
women.
older than
You
you
can't
are.
tell black women like because the skin and stuff.
Grandmother.
Your grandmother?
Yeah,
That's right. That's what I'm trying to say. Your grandmother too? Anyone? No? All right. Well, I can't tell age. That's what I'm saying. It's like black people is just.
My first child is 34 years old.
Oh, that's crazy.
My first child is.
So that when you walk down the street, they say y'all sisters, probably.
Yeah.
Yeah. That's why they don't like black people. I mean, that's why. I'll come back with these. I'm gonna print these up right now. Let's hope that it works or whatever, and I'll be right back.
I hope it works.
It's gonna work. It's gonna work. I'm gonna